Recently, we had a discussion about the evidence for Peloid therapy or the use of Moor Mud for some health conditions. So one of the things that's really important to me is that anything I offer to my clients should have some evidence behind it to prove its efficacy. So how do we know that the evidence we have is valid and can be trusted? So there are a few criteria you can use to assess the validity of research, and they are as follows. First off, it should be a randomized controlled trial. That's widely considered the gold standard of clinical research. Secondly, it should be published, and it should be published in a peer-reviewed journal. Peer review means that other researchers review your work just to determine the validity, to make sure that nothing got missed and to make sure that you're interpreting results correctly. And the other important consideration for evidence is that it should be current. There's lots of great research that's been done on Moor Mud and Peloid therapy over millennia, but it's important to know that research continues and that what we have is continuing to show effectiveness. So I want to present a few different pieces of research that came up in a recent discussion of our Esties and their Besties meetings, which are held weekly. I'll put the link in the description of this video. So the first thing I wanted to talk about is the effect of Moor baths on physiological stress response and psychological state. This is a randomized controlled trial that was published in 2017, and the irony is not lost on me that here we are in 2022 experiencing as a population more stress than we've ever had. So it's kind of a good time to talk about this. So what they did was they had two groups. There was the control group and a group that was enrolled for treatment in a 3-week prevention program for those who are at risk of developing burnout syndrome. So the pilot study was set up to assess the effect of a single Moor bath. The group received a total of 7 treatments, each consisting of a Moor bath followed by a rest period over the course of several weeks. And what they did for this particular piece of research was not only did they assess the participants' perception of stress, but they also looked at something objective, which is salivary cortisol levels. So they tested those over the period too. And what they found was that the pilot study provided initial evidence on the stress relieving effects of single Moor baths, which can be a sensible and recommendable therapeutic element of stress reducing programs. They found a significant decrease in salivary cortisol concentration in week 1 and also continuing to week 3. So they still want to have more research to validate that, but I think it's a really good start. Also on the topic of stress is another trial, a randomized controlled trial published in 2014, which talks about the stress relieving effects of short-term balneotherapy. Balneotherapy is the umbrella under which Peloid therapy falls. It's the bathing aspect of Peloid therapy. These were healthy adults, and they compared muscle relaxation, and they measured, again, salivary cortisol. So it was randomized to either balneotherapy and progressive muscle relaxation or a resting control group. So each intervention lasted 25 minutes, and they rated then their state of relaxation on a scale in addition to measuring salivary cortisol. So what they found was that balneotherapy seems to be more beneficial with regard to subjective relaxation effects and beneficial in regard to a decrease in salivary cortisol. Cortisol is the hormone that promotes the fight or flight response. So lower cortisol equals more relaxed. So moving away from stress and relaxation is something, an inflammatory condition, arthritis. So I have 3 more pieces of evidence that talks about osteoarthritis. The first one in hands, and then the other 2 are in knees. So hand osteoarthritis is associated with pain in your hands, reduced grip strength, and a loss of range of motion. So some significant things causing pain, and quality of life too, it should be really considered. So this was another randomized controlled trial published in 2017 that talked about, had 2 groups. One group that underwent Peloid therapy over 2 weeks, 5 sessions a week for a total of 10 sessions, and home exercise, and the control group were only assigned the home exercises. They evaluated them on hand grip strength and pinch strength, and what they found in the in group 1, which was the group that was assigned Peloid therapy and home exercise, was that there were statistically significant improvements in all parameters at week 2 and week 6, so that Peloid therapy has long-lasting effects in the reduction of pain for hand osteoarthritis. That was a pilot study published in 2017. And what they say is that this study demonstrates that Peloid therapy might be an effective and confident treatment modality in the management of symptomatic osteoarthritis of the hand, and can provide effective pain control and improvement in hand function. So I think that's really, and when you think about the risks of Peloid therapy, they are none. They are none. So the fact that it can improve quality of life, grip strength, pain reduction, I think that's really important. Next study is another randomized controlled trial published in 2019, and this one talks about knee osteoarthritis, which is a significant factor for adults as they age, another inflammatory condition. So what they were doing, they were assessing the fact of natural factors, which is Peloid therapy, and on changes in the functional state of patients with knee joint osteoarthritis. So they sorted the groups into one that was receiving treatment of 10 baths plus physical therapy, or physical therapy alone every other day. So then they assessed the effectiveness of the treatment based on some questionnaire indicators, and what they found was in the treatment group that there was significantly greater walking speed, testing of sitting down, standing up, circumference of the knee joint, and flexion and extension range of the knee joint was improved, and pain scores were also improved after even a month after the treatment. So what they're saying is that balneotherapy and Peloid therapy effectively reduce pain and improve the functional state of patients with osteoarthritis of a knee joint, and that's 2019. Finally, one more is the effect, this is 2016, it was published, the effect of mud therapy on pain and quality of life related to health in patients with knee osteoarthritis. And this was a prospective controlled trial, so not a randomized controlled trial, slightly less of a gold standard, but still quite effective. And when we measure all the research together, it also has an impact. So in this situation, the researchers concluded that mud therapy in patients diagnosed with knee osteoarthritis attained immediate effects on perceived pain and quality of life, reducing the consumption of specific pain relief drugs. And that's really what it comes down to in the end, is Is your life better as a result of this treatment? And we think it is. If you have any more questions about Peloid therapy, Moor therapy, we're always here to answer them for you. And please feel free to message us on our website or to leave comments below. Thank you.